My name is Leticia Gutierrez, and I'm running for Congressional District 9. I'm an immigrant. I've been in this district for over 45 years. I'm a government relations director for a nonprofit organization. We try to deliver better health outcomes in this district. I live not too far away from here. I've been working tirelessly for the last 15 years to bring better health outcomes for our children. I'm a mother, a proud mother, a Blue Star mother. For my son is currently in the United States Army. I also have a daughter that attends the University of Houston. So I'm very, very, very much vested in a lot of what's happening in our district. I personally feel that there's unfortunately a lot of things that are coming from this current administration that's causing a lot of fear, that is bleeding into negative impacts also as it pertains to small business health. And so that's something that I have been committed to addressing and making sure that that people know that as immigrants, we're here to work. We're here just wanting a piece of the American dream, just like everyone else. So I thank you so much.
Thank you. 60 seconds. Outline your top 3 campaign priorities and tell us what is the top issue you will individually address if elected, or what's the first bill you will pass.
If it's one thing that I hear over and over again from this district is affordability. I want to be able to raise the minimum wage because right now the median income in this district is $70,000, and I want to be able to double that. I've already worked with, I sit on the Ports Community Advisory Committee to make sure that those jobs that they are promising are coming to this district. The second thing is healthcare. As a mom and a single mom with 2 kids, that I had a son with upper respiratory issues, it was very tough to be able to decide whether I should take him to the doctor if I was going to be able to afford to put food on the table the next day and have to do without. We need to be able to expand these affordable care subsidies to be able to have families not to continue to suffer through and break the bank whenever they have to go to a regular doctor appointment. Immigration is at the top as well, my number 3. The way that we are currently treating even those that are here documented is not right, and it's not humane. We can have secure borders, but we can also make sure that we have a pathway to citizenship.
Leticia, we're going to cue you up first for question 3. 60 seconds. Tell us how, as the CD9 representative, you would support a business-friendly agenda to meet large and small business priorities in both the urban and rural parts of your district.
Thank you. So one of the things that is currently right now, as it pertains to the federal government, there are departments like the Department of Economic Development to be able to rein in some of those dollars and bring them back to this district. There needs to be a serious investment in our small businesses right now. They are hurting, and that's a lot of what I'm hearing, not just as it pertains to community or their clients coming in to spend money, but also for them to be able to have access and have an opportunity to also bid on some of the state contracts and some of the port contracts. There is some very lost opportunity with some of the small businesses that have been trying relentlessly for a very long time. And unfortunately, it's still the good old boy system. And we need to be able to make sure that, some of our NWBE women and minority-owned businesses also have access to that, not be taken away the way that the current governor has been trying to do. So I would be a huge advocate for that.
Thank you. Ernest? Transportation and infrastructure are priority items for the Pasadena Chamber. How would you seek and secure comprehensive infrastructure investments for our region?
I've been working with our current County Commissioner, Adrian Garcia, to make sure that those infrastructure dollars come back to our county for the aging infrastructure that we currently have, because as a percentage of income, this district actually pays more into a system that it draws down from. So making sure that those dollars come back to this district has already been a top priority of mine. I've actually worked, happy to see here Councilmember Pat Van Hout. I've worked with the city of Pasadena in the past through the organization to make sure that we had pop-up bike lanes for some of the students that had requested that. Had brought private funding to make that happen. I've also, as it pertains to public transit, I've worked tirelessly. I know that Pasadena is one of the main things that they've asked for is to have a connectivity between Houston and Pasadena and beyond. We need that.
Thank you. Pasadena Chamber members identified healthcare. You have Y'all have already brought that one up, but they identified it as a major business concern. What plans do you have to address access to health care, the escalating cost of health care, and how do you manage mental health care within those same cost constraints?
As a mom that had a child that suffered with upper respiratory issues, it was very difficult. And when his pediatrician pointed to our zip code as being one of the main culprits for his issues, I did a 180 on my career. And I've made it my mission for the last 15 years to bring better health outcomes to community. And that's been walking the halls of DC as well as our state capitol to make sure that we provide, that we have our current industrial facilities abiding by the law so that they don't put chemicals into the air, into our water, making us sick. I genuinely feel that industrial facility has a responsibility to community to be good neighbors, and that they should invest in clinics and expanding a lot of the healthcare that we currently have right now that is shrinking. I think that if you live 2 miles or less from industry, you should get free healthcare, because a lot of the things that are unfortunately coming down the pike is making us sick.
Tell us how you plan to work across the aisle in a divided House of Representatives where neither party is projected to have a significant majority. 45 seconds.
As a government relations director, this is something that I'm consistently having to do. I have sat down actually with Dan Crenshaw to make sure that they provide more funding in this area for extended some of the air monitoring to make sure that we are getting the right readings and protecting communities' health. I've sat down with Lieutenant Dan Patrick to make sure that there was a moratorium on certain air permits as it pertains to certain industrial facilities that was wreaking havoc on children's health because it was near a school. I've had to sit down with Ted Cruz as well to make sure that after the ITC fire that happened not too far from here, that he understood that there was community that was sick, and he did. He actually helped, and we had a meeting. So I've consistently had to reach across the table to make sure that not just staying friendly to our own.
Campaign promises are easy to give. When you're up here, tell this audience how the resulting work and accomplishments that you're going to do will deliver on those actions that you have talked about. So again, you have 2 minutes to do that. When you hear the bell, your time is up.
Thank you so much for sharing your evening with us tonight. My name is Leticia Gutierrez. I have been living in this district for over 45 years, and I chose to raise my family here. I went to school here. I graduated from Milby High School, and I was the first one in my family to graduate from University of St. Thomas. And I have already been working tirelessly in this community to bring back better health outcomes. You can't put a price on your health. And that doesn't mean that we're trying to do away with our big industrial neighbors. It just genuinely means that we can do better. And other states have proven that we can do better. And with that said, you have my utmost commitment that as I've been working on every single level of government, I'm the only one here that has already been walking the halls of DC, pulling on every single representative in our area to make sure that we bridge our community stories with a lot of the data and science that we've been working on. I always say the community has a PhD. They know exactly in their community because they know exactly what is needed and what they want. So I plan on developing community councils in each of the municipalities up and down this district to make sure that we meet on a pretty regular basis, and for you to tell me how exactly it is that we can come together to bring all of the needed players to bring things to fruition as it pertains to small business, as it pertains to infrastructure, and as it pertains to immigration. I have a proven track record already, and I promise you that I will be beholden to you. I'll just say one last thing. My kids don't even like to go with me to the groceries because every single time we go, it's a 2-hour trip. I'm always bumping into community. People know who I am. If you don't, please find us on LeticiaForCongress.com. You can also Google me, Leticia Gutierrez. My former married name is Leticia Blaza. I've been quoted in the New York Times. I'm on NPR every other month. I've been on pretty much every publication, including the Houston Chronicle, talking about how I've been striving for better for our community. I promise you that I will, if you give me this opportunity, I will not let you down. Thank you.